Good morning, everyone. Welcome to today's ESP lecture on the roles of radiologists and radiographers in a clinical context. Today we focus on a critical aspect of your future workplace, understanding the distinct roles of the radiologist and the radiographer. In a clinical setting, clear communication between these two roles is vital for patient safety, as highlighted in studies on interprofessional communication. Let's clarify their scopes of practice. The differentiation lies in their training and primary function. The radiographer is the technical specialist. Your role, as future D3 graduates, involves operating the specialized equipment, like X-ray, CT, or ultrasound machines. You are responsible for preparing and positioning the patient correctly and ensuring the images captured are of high quality. Crucially, radiographers do not diagnose conditions or interpret the final images. The radiologist, on the other hand, is a fully qualified medical doctor. Their primary role is image interpretation and providing the final diagnosis based on the images the radiographer obtains. They write the detailed report that guides the referring physician. Patient preparation is a shared responsibility. The radiographer is often the primary person interacting with the patient before the scan, explaining the procedure, ensuring safety protocols are followed, and obtaining informed consent regarding the procedure itself. The radiologist is ultimately responsible for the safety of the procedure and ensuring the indication for the exam is appropriate. Both roles require excellent patient interaction skills. Effective communication is the glue that holds the process together. Radiographers must clearly document technical details and any issues encountered during the scan, so the radiologist can accurately interpret the images. While the radiologist provides the final diagnostic reasoning, the radiographer's technical notes are essential input for that shared clinical reasoning. Clear, professional English is the language that bridges these roles. In summary, the radiographer focuses on acquiring the high-quality images, and the radiologist focuses on interpreting those images to establish a diagnosis. This teamwork is non-negotiable for optimal patient outcomes. In your ESP class, we will focus on the language needed for these precise interactions.
Now that we have explored the distinct roles, responsibilities, and the importance of communication between radiologists and radiographers, it's time to engage with what we've learned. To deepen your understanding and ensure you can apply this knowledge in real-world scenarios, I have prepared some open-ended comprehension questions. These will encourage you to think critically about the concepts we've just discussed. Let's dive into those questions. 1. What is the primary difference in the scope of practice between a radiographer and a radiologist? 2. Describe one specific task that is part of the radiographer's responsibility in patient preparation. 3. Why is clear documentation from the radiographer essential for the radiologist's work? 4. How does the concept of shared clinical reasoning apply to the interaction between these two professions? 5. Why is effective interprofessional communication important for patient safety? 6. If a radiographer notices an issue with the patient's positioning mid-scan, what is the expected communication protocol?
Great job engaging with those comprehension questions. Your insights will serve as a solid foundation as you continue your studies in radiology. To further enhance your understanding of the roles and responsibilities we've discussed today, I encourage you to explore the academic references provided. These resources will offer more in-depth information and perspectives on the vital collaboration between radiologists and radiographers. Let's take a look at those references.
Practice is the key to mastery. Every effort, no matter how small, gets you closer to perfection. Keep going. Your dedication will pay off. Latihan adalah kunci menuju penguasaan keterampilan berbahasa. Setiap usaha, sekecil apapun, membawa Anda lebih dekat ke kesempurnaan. Teruslah maju, dedikasi Anda akan membuahkan hasil. Salam dari Pak Budi.